Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and all the videos in my channel are directly referenced from the internationally accepted US National Medical Library, so you can trust these videos. So today we're going to talk about hyperpigmentation of your skin, specifically melasma. So this video has been in demand and a lot of people have been asking me, requesting me to make this video. So here I am. Today we are going to talk about everything there is to know about melasma. So let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Before starting the discussion on melasma, first you need to understand that your skin that has turned darker or lighter than normal is usually not a sign of a serious medical condition. Normal skin contains some types of cells called melanocytes, and these cells produce melanin. This substance, melanin, is what gives your skin its color. So, skin which has too many melanocytes is hyperpigmented skin, and the skin which has little or less melanocytes is hypopigmented or depigmented if melanin is absent. So why is melanin needed? This melanin protects our skin from the harmful radiations, UV rays of the sun, so that your skin does not generate cancers, or else you will have a higher risk of skin cancers if you do not have melanin. So that's why people who are white have more risk of skin cancers as compared to darker people. So whenever there will be a underactive melanocyte who is not working properly, the area of the skin will become pale, and whenever there is an overactive melanocyte, the area of the skin will become dark. Now, bronzing of the skin may sometimes be mistaken for tanning, suntan. This skin discoloration often develops slowly and starts from your elbows, knuckles and knees. Starts from your elbows, knuckles and knees and spreads from there. Bronzing, this bronzing may also be seen on the soles of the feet and the palms of the hand. This bronze color can range from light to dark in a fair skinned people, and the degree of darkness is due to the underlying cause. And there are many causes of hyperpigmentation, darkening of the skin, ranging from inflammations, skin inflammations, drugs, using of certain types of medicines, hormonal changes, then deposition of iron overload, pregnancy. Hormonal changes are very commonly seen in pregnancy and which are associated with skin changes, and sun exposure. Sun exposure is the number one cause. Now, since we are talking about pigmentation of skin, since we are talking about hyperpigmentation, let's just briefly check what is the cause of hypopigmentation. If you talk about hypopigmentation, why will the melanocytes be less active? They will be less active because of any kind of skin inflammation. Sometimes they can be because of fungal infections like Tinea versicolor. That's one type of fungus which causes localized hypofunction of melanocyte. Therefore, the color is lightened. Then pityriasis alba is another organism, vitiligo, and certain medicines. So all these can actually lead to light colored patches on the skin. Now let's now come on to melasma. Melasma is a common skin problem, very common. Melasma is characterized by brown to grayish brown patches, usually on the face. Most people get it on the cheeks, the bridge of the nose, the forehead or the chin, and above the lip area. It can also appear in any other part of the body which gets a lot of sun exposure, such as forearms and neck. So, one of the most common reasons for melasma is sun exposure, and therefore one of the most common treatment is sun protection. Now, sun protection, this does not just mean a routine protection. It means wearing sunscreen every day and reapplying the sunscreen every 2 hours, and plus you have to wear a wide brimmed hat outside whenever you go in the sun, because sunscreen alone may not give you the protection you need. Now, women are far more likely than men to get melasma, and like I said, hormones have a very big role to play. That's why it is very commonly seen during pregnancy, and sometimes that's why it is also called the mask of pregnancy. So melasma, hyperpigmentation depends on your hormone levels, depends on your sun exposure, depends upon your gender also. Women are more likely. Then age also has a factor. All the wrinkles and the freckles which you develop as you age are more prone to these kinds of hyperpigmentation with the exposure of sun. Now this is the only symptom of melasma, that there will be color change on your skin, which is harmless by the way, but many people dislike the way melasma makes their skin look, and therefore they become depressed, conscious, anxious, and seek treatment. So melasma does not cause any other dangers to your body. It is not dangerous if it is just melasma. There might be other reasons, like we talked. There might be other causes for hyperpigmentation of your skin, which is not melasma, but melasma is not a dangerous thing. Now, if we talk about why melasma happens, what is the reason for this hyperpigmentation? So the exact single reason is unknown, but it is seen that people who are already darker, like Latin, Hispanic, North African, African American, Asian, Indian, Middle Eastern, Mediterranean, all these people, they are more likely to get melasma. And people who already have a blood relative who has melasma are also more likely to get melasma. So there are two things here. That means people who have a darker skin already have a more active melanocytes, because you must know every 28 days your skin layer changes, right? So if your skin layer changes every 28 days, your skin has to produce more cells and has to produce melanin also, because your skin color should look the same according to your own. And depending upon your exposure to the sun, it produces more melanin the next time. People with a darker skin have more active melanocyte, and therefore as compared to lighter skin people, they have a more chance of developing melasma. And genes, genetics also have a little factor to play here. But as we talked about, sun exposure, hormonal changes, medicines, some skin products, they are the key factors, key reasons why you might have melasma. Sun exposure, because ultraviolet light from the sun, it stimulates the melanocytes, because ultraviolet light is damaging and it can cause free radical damages also. It can cause mutations in your skin leading to cancers. That's why your body protects you by producing more melanin. Even a small amount of sun exposure can make melanin return after fading in people who have melasma. So sun exposure is why melasma is more often seen in summers. So sun exposure is why melasma is more often seen in summers, and it is also the main reason why people with melasma get it again and again, going back to the sun. So that's why protecting yourself from sun is so important. Then obviously a change in hormones. Hormones play a very important role in all the secretions of the body, including melanin secretion. So pregnant women, that's why they are more likely to get melasma, When melasma appears in pregnant women, it has a name, mask of pregnancy or chlosma. The birth control pills and hormonal replacement medicines can also trigger melasma because they are also altering your hormonal balance. And certain skin care products, if a product irritates your skin, it can make melasma worse. Then let's talk about how do we diagnose melasma. Dermatologists can diagnose most patients by just looking at the skin, and to see how deep the melasma penetrates your skin, your dermatologist may look at your skin under a Wood's light. Sometimes melasma can look like other skin conditions. Therefore, to rule out other skin condition, your dermatologist may need to remove a small bit of a skin. This is called taking a skin biopsy, and a dermatologist can safely and quickly perform this skin biopsy during just an office visit, just an OPD consultation. So skin biopsy can confirm the condition. So how do they treat melasma? What is the treatment? See, first of all, you need to understand, if you do the necessary precautions, melasmas can fade away on its own. This usually happens when the trigger, such as hormonal changes like pregnancy, birth control pills, or sun exposure, which is causing the melasma, is gone. When a woman delivers a baby or stops taking these birth control pills, melasma fades. That's the point. So sometimes no treatment is needed. But for some people, melasma can stay for years or even a lifetime. If melasma does not go away for a woman, if melasma does not go away, or if you want to keep taking your birth control pills, then some treatments are available. These includes hydroquinone. Hydroquinone is a medicine which is very commonly used as the first line treatment for melasma. It is basically applied to the skin, to the only affected skin which is hyperpigmentated, and it works by lightening the skin. So you will find this hydroquinone medicine coming in various combinations in creams, lotions, gels and liquids, and you can get this medicine without a prescription also. These products contain less amount of hydroquinone than a product that dermatologists can prescribe. So obviously a lighter version you can get without a dermatologist, but if you want actual good results, you'll have to go to the dermatologist and take a good prescription hydroquinone medicine. Then the second type of medicine we use are tretinoins and corticosteroids. These are used to enhance your skin lightening, and only dermatologists can prescribe this second line of medicine. And sometimes some medicines can contain a combination of these three: hydroquinone, tretinoin and corticosteroid in one cream. This is called a triple cream. Many products are available in the market with this triple cream. So these also help. But if there is an infection, corticosteroids can flare the infection, and tretinoins are harmful in pregnancy. So that's why don't try to use these medications on your own without knowing any of these things. Without knowing side effects, you can harm yourself. So it's better to consult a doctor, better to consult a dermatologist. Because after all, melasma is not harming you. So why should the treatment harm you, right? So there are some other things which can be used for treatment, which can assist you. The doctor can prescribe you azelaic acid or kojic acid. Now, these acids are also used to lighten melasma. Then lastly, if medicines do not get rid of your melasma, then a procedure can be done. Procedures in melasma are like chemical peels, microderm abrasions, and laser treatments or light based procedures. These are all the procedures which a dermatologist can perform to lighten your skin in that localized area. Now obviously a specialization in the field is required to do all these procedures, because a new skin condition can occur if the person, the doctor who is giving you the treatment, does not tailor this procedure according to your skin type. So ask your dermatologist about the possible side effects, health problems that can result from these treatments, and if you notice any of the following after getting treatment for melasma, be sure to call your doctor again. Like if you're getting skin irritation, if you're getting darkening of the skin, or if you're getting other problems on the skin or your body. Now let's talk about outcome of melasma. Now if you take treatment for melasma from a dermatologist, many people with melasma have a very good result. But melasma can be stubborn. It may take a few months of treatment to see improvement. But it is very important for you to follow your doctor's advice to ensure that you get the most benefit from your treatment, and it can also help avoid any other skin irritation or other side effects. When after your melasma clears, you may need to keep treating your skin still further, because your dermatologist may call this a maintenance therapy, which can prevent the melasma from returning. So you can help prevent melasma from returning by skin protection, wearing sunscreens and wearing wide brimmed hat every day. So the most important tip here is to wear a sunscreen, which is one of the most common treatment of melasma, and how to choose a sunscreen is also important here. You need to choose a sunscreen which offers a broad spectrum protection, which has a sun protection factor SPF of 30 or more, and it also has a zinc oxide component and zinc oxide and titanium dioxide. They help to physically limit the effect of sun rays on your skin, and you need to apply this sunscreen 15 minutes before going outside. 15 minutes, because it takes time for this sunscreen to start its protection. It's not something like a physical thing ki abhi lagaya aur abhi. It's not something which starts immediately. 15 minutes before going outside, and reapply it every 2 hours. That's the intensity of protection you need from the sun. Then second thing, wearing a wide brimmed hat, sunglasses when you are outside is very important. Third, choose very gentle skincare products. Don't choose harsh skincare products. Don't irritate your skin. If you do irritate, your melasma will get worsened. And avoid waxing. Waxing can cause skin inflammations, which can worsen melasma, or you can avoid waxing the areas of the body that are affected by melasma. So you can ask your dermatologist about other types of hair removal methods which might be right for you. Then if your melasma is not going away by all these things, don't hesitate to consult a dermatologist to discuss the available treatments and what will be the best in your skin type. And you might need a procedure for this time, but you can go for it. But don't worry, melasma is not a dangerous condition. It's just that your appearance is little darker. But don't worry, melasma is not a dangerous condition. It's just your appearance. If you can rise above that, you can ignore it. But if you want a treatment, consult a dermatologist, and you can follow the tips which I told you in this video. So guys, best of luck. So that's all about melasma and hyperpigmentation. Hope you've understood the video, and if you have any questions specific to melasma, you can write down this comment, but I'm not going to treat anybody's melasma. I'm not a dermatologist. I'm just trying to give you the authentic information which you might not be able to find in all the cluster of bullshit information giving on website. So that's what we are doing here. We are giving you authentic and certified and internationally accepted information simplified in a layman language for your understanding. That's what Dr.Education is all about. There are many videos present on my channel. Don't forget to check them out. Many other health concerns which you might have may be very simply explained. So you can take benefit of these videos. So can many others. So don't forget to share this channel within your friend circle, and Till next time, I'm Dr. Paramjeet. Those who don't know me, I'm a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi, NCR. See you tomorrow. Stay connected, stay healthy. Now, melasma is more common now of the sun, and it has a little genetic, and it has a then skin product, then certain things, a lot of hope you've understood, hope you have decided information. Chlaosma.